Okay, so now we're shifting over to our technology presentations. We're going to start off with patient-centered care coordination from Hucu.ai. So to tell us about it, Asif Khan, CEO of Hucu.ai, with Karen Paulus, CEO of Nest in Place.
Hello, everybody. Asif Khan here. I'm the co-founder, CEO of Hucu.ai. Hucu is short of two Latin words, hook and cure, which means care anywhere. So how many of you know how to text? It's a stupid question. Everybody knows how to text. Don't raise your hands. So the point is, we all know how to text. What we built is first of its kind, patient-centered messaging. Everybody in post-acute care or in healthcare, we all communicate via text. Whether we like it or we don't, it's happening. So we built care coordination within texting. It's 10x better than any other texting out there because number one is patient-centered. So each patient becomes the center, and you can bring the care team together from anywhere in the world on the fly, dynamically, instantaneously. They don't even need to have the technology. They can be part of the messaging. That's number one. Number two, it's built with AI and algorithms to speed up and accelerate it in an accelerated manner your care delivery workflows. What that means is the frontline workforce, they don't need to think about, okay, this just happened, who should I contact? What is their phone number? How do I reach them? Are they gonna be able to respond to me in a timely manner? Or are they on vacation? So it accelerates that process and gets the right people in that patient-centered communication, so now they can feel supported and helpful, and they can take care of the patient immediately. Number three, as they communicate, our algorithms automatically calculate an acuity score from 0 to 100, 100 being the highest. So now if you have 20,000 people or that you're caring for, or 5,000 lives, you know which 20 are the highest acuity. And now you can all focus on those 20, drill down, and kind of figure out how you can support your teams. So with all of those, what ends up happening is people are saving 1 to 2 hours per day per employee, which is reducing their burnout, right? And keeping them more satisfied. And as they're more satisfied, obviously, they don't look for another job. There you go. So it's super easy to use Hucu. You can download it right from the App Store or on the web. There's a free forever version. So you can start using it right away. We integrate with all different types of technologies. And it takes literally 3 days to plug in Hucu. We have a plug-in widget that we use, and we don't charge for integration. So that's a little bit about Hucu, but to talk more about a real-life experience, I want to introduce you to Karen Paulus. She's the CEO of Nest in Place, and take it away, Karen.
Thank you. Okay, yeah, like you said, I'm Karen Paulus. I'm actually a physical therapist by trade. And I spent 22 years working in all different aspects of care, acute care, in rehab, in outpatient, in home health, and ended up doing geriatric house calls. And at the same time as I was doing geriatric house calls, my own dad was diagnosed with primary progressive aphasia, which was a very rare form of dementia until Bruce Willis got it. So until then, nobody really knew what it was. So in advocating for him and trying to coordinate his care, the one thing I realized is communication in healthcare is questionable within organizations and almost non-existent sometimes between organizations. And anybody who's figured out that communication piece really has figured out the key to delivering quality of care. So then I guess I had a midlife crisis maybe and decided to switch gears and open Nest in Place. We're a private duty, non-medical, and we offer solution-based cares with built-in care management. And as part of coordinating and advocating, I was really looking for an excellent solution for communication, especially considering I built the whole thing through COVID. So as we've seen this whole conference, the common challenges that we're all facing, and we hear these themes again and again, and really building culture into the company and employee satisfaction, because if they're satisfied, then we can have employee retention. And we're all very passionate about providing that high quality of service And that's the foundation. So if you don't have those foundational pieces, that's really what is going to accelerate the growth of it. So when I talk about solutions that I tried that didn't work for us, again, in starting the company, we started out with the limited group texting, one-on-one messaging, just really inefficient, not feasible as we grew into any kind of company. We also work with a VoIP, same thing. The industry standard is the notebook in the home, which takes a lot of good information and it kind of dies there. Whereas Hucu is a living, breathing, real-time solution. One-on-one phone calls and texting with patients' families, again, just really not feasible in any kind of continuable course. And then we also explored the family rooms and portals of various EHRs. And while I think that they have good intentions, they just don't really provide the features and benefits that Hucu has given us. So when we look at the first challenge, how do we foster culture? So this is actually live from my company. You can see the different channels that we have that the caregivers can go into. So on day one, we start with our culture. When somebody is a new caregiver, we have one of those channels that says all employees. My management staff is tasked with saying, hey, team, welcome to Courtney. She's our new caregiver. All of the caregivers on my team jump in and say, welcome, Courtney. It's great to have you. You're going to love working here. So that culture is built right off the bat. They really automatically feel a part of that team. And then as they start to navigate Hucu and see the things that are available to them, they scroll down to, you can see the one with the heart that says, I love my pet, which the caregivers created. And then they jump in there, they see that all the caregivers have put in these cute little pictures of their pets. They put in a cute little picture of their pet, and then the other caregivers, oh, that's so cute. And they automatically feel that culture, like they're a part of the team. And that happens on day one. And so, so our net promoter score, we're proud to say is 75. So when you compare that to Apple, which is a 41, or Amazon, which is like 51, or the Ritz-Carlton's a 38, that's something that we're insanely proud of. So then as we move on to the second challenge is their productivity and their satisfaction. So this is an example of kind of what they'll see. They have a list of their clients, they click on the client's name, and then that takes them to a caregiver chat. They're in a caregiver chat with every caregiver who sees that client. So they can go back and they can see all the way back to the beginning of when we admitted that client, any communication that's in there that they need to know about. And then as they scroll back in there, they really see the good work that their colleagues have been doing with that client. They have a toggle button that toggles them over to the family side. Now they're in direct communication with the family. So you may have a daughter who says, hey, can the caregiver who's going today file mom's nails? And then the caregiver sees that. Well, now she's seeing the pictures of the good work that's already been done. So she's going to file those nails. She's going to paint them bright red. She's going to pair it with some lipstick to go with it. Then she's going to take a picture of it. It's all HIPAA compliant. So when the caregivers take pictures, or if we're working with an external collaboration of a nurse taking pictures, it's all taken in the app and not saved on the caregiver's phone. So then they post their picture, and then all the other caregivers, oh, she looks beautiful, what a great thing. And then the family chimes in, thank you so much, that's wonderful. Now you have a caregiver who has just, on day one, done excellent work and gotten immediate positive feedback for their good work. And that's how we build the culture of the company. 100% of my caregivers say that Hucu saves them time, and 90% satisfaction. So then as we move on to challenge 3, which is how we take all that and turn it into retention, we have engagement tracking. We can actually track how people engage with Hucu. They have that healthy competition. They see the good work that their colleagues are doing, and it makes them want to do good work. And then performance recognition. It's actually built into the culture of my company that my management staff goes in after every shift report and says to that caregiver, thank you so much for doing that. We appreciate your good work. And again, that's the culture that we've created because if it's 10:30 on a Saturday night, nobody wants to feel like they're in it alone. So we have managers going in and just saying, thank you so much. And they really feel like they've provided that shift report, they've completed that shift and taken care of that person, and that good work is recognized. 81% of my caregivers say that they feel more connected with the team, and 75% are more efficient. So then, moving that forward to creating an excellent quality of care, we have those real-time connections. That's with families who are on vacation. That could be family members who are in a different state. That could be all of our external collaborators, whether it's a hospice or it's a home care nurse, it's a primary care physician. All of those connections happen in real time. You get those timely updates, whether it's for coordination of care, or it's just a daughter saying, hey, I've been trying to call mom all morning and the phone is off the hook. We get that one a lot. Can somebody just make sure her phone is charged? So the caregiver is able to navigate that in real time. The transparency, as a management staff, my management staff is able to go in and maybe somebody's having a hard transfer that day. Mental note. Okay, the next day they're having a harder transfer. Now my management staff knows that they need to proactively do something to help navigate that situation, and that's how we keep people out of the hospital. Because my management staff is able to see all of the communication. And then the historical communication. If we have somebody who is starting a home health episode and we want to add the home health nurse to what's going on, they don't just have access to demographics of that client. They actually have our history of what has transpired with that client since the beginning of when we were seeing them. And the result of all of that is, we have very high marks for our quality of care and also satisfaction with clients and obviously their families. And 93% of my employees see a 75% increase in family communication. It's interesting because we actually can track the engagement of our clinicians, and we found that when we recognize them more and we recognize their good work, it makes them want to engage more. So the whole thing kind of works together. And then, so focusing on all of the things that we've just talked about, creating that positive culture, the supportive teams who are aligned with our vision, that are satisfied with their job, it really allows us to go to that top of that pyramid and focus on growth. We have a 44% turnover rate, which is below the industry standard. It's a number I'm not satisfied with. So I've actually taken my recruiting and added that to Hucu to help streamline that process, and I'm hoping that that number really gets much lower in this year. And then back office expenses, because I built the whole thing through COVID, I've really learned to use Hucu as my virtual office. We upload all of our company and client receipts to Hucu. My accountants are in there and have access to that as external collaborators. Paperwork, we basically have a paperless office because we just kind of navigate everything through Hucu in different channels, so it's all nice and organized, and it really allows the whole office staff, the schedulers, and all the caregivers to, in one centralized place, have all the information that they need. So just in summary, these are the reasons why we've chosen Hucu. The HIPAA compliance, obviously we need that virtual office. We have lots of analytics that they can provide for us with the flags that Asif was talking about. We have such a good culture and good visibility, and we've really created a dynamic care team. Hucu consistently ranks higher on G2. And then at the top, in the top right, you can see users love us. That's me, I'm users. So yes, thank you so much for the opportunity today. I really do believe that this is our secret sauce that really puts us above anybody else in my area who's doing what I do. So thank you.
All right.